Hello, everybody. In this tutorial, we are going to talk about three really important topics in human anatomy, and that's anatomical position, directional terms, and the anatomical planes. Now, these are going to be super important for you later in the semester and all throughout the rest of your studies that have to do with anything about the human body, okay? And that's because they are standardized vocabulary for any type of healthcare career. Okay, so we are going to start with anatomical position. Now, anatomical position is the standardized position that we refer to in healthcare practicing that standardizes the location of any point of interest in the body. Now, let's kind of go over what this position actually is. Okay, so here you have me standing there in anatomical position. There's a couple things you want to take note of as you are looking at somebody in anatomical position. One, for sure, assume that the individual is standing upright and facing forward. Okay, facing forward in general, we'll talk about other things that need to be facing forward. For instance, like your palms of your hand and your toes, they're all going to be facing forward in that general direction. The patient's arms also need to be by their side. And last but not least, their head needs to be facing forward and have a level gaze. In other words, your chin is going to be level with the ground or parallel with the ground. No tucking the chin in or up or turning the head at all. We want them to be facing forward. Okay, this is anatomical position. Now, this is really important because we're going to utilize directional terms in order to, for instance, I don't know, pay or describe a certain pain that's found in the left or right upper quadrant, right? So let's go ahead and get into directional terms. So directional terms are used in order to show where a point of interest may be relative to other parts of the body. For instance, anterior versus posterior, rostral versus caudal, superior versus inferior. They're basically just telling you what direction you move in the body in order to find that point of interest. So to describe things that are toward the front of the body, so if we look at a lateral view of the body, me turn to the side here, anything that is toward the front of the body here. Okay, so maybe your belly, the outsides of your belly, right? This is what we say is anterior. Okay, you are anterior, or it is anterior to something else. Again, this is a relative term. So my stomach is anterior relative to my butt. Okay, my butt is actually toward the back of my body or posterior. Okay, a good way to remember this is thinking about your butt, your posterior end. Okay, so anything that is towards your back of the body or towards your butt is posterior to something else. In other words, your butt is posterior to your stomach. Yeah. Okay. What about a point of interest that is actually toward the top of the body or towards your head? Okay. Well, this is what we use the term, or when we use the term superior. Okay. And anything that is toward the bottom of the body or towards your feet, this is what we use inferior. So what I like to tell my students is if you are, or if anything is above, so above something else, you are above them, you are superior, you have a superiority complex, right? Because you're above that. Anything that is superior is going to be above. And then in the flip side, anything that is below you, they are inferior to you, right? They are not as good as you. That is what it means to be inferior in a social context. Okay, so inferior means below and superior means above something. So in this context, my feet are inferior to my head and my head is superior to my feet. Now, in the same token, we can use another term here, rostral and caudal. So to be rostral means that you are closer to the head region, okay, specifically the head region or the cranium. Actually, rostral rhymes with nostril, like on your nose. So if it helps, think of rostral like your nostril, and it's toward the direction of your head, okay? Now, caudal just means it's towards your tail or your tailbone here. And this has to do with embryology mainly, okay? So to be caudal means that you are closer to your tailbone. You're coddled like a little baby, okay? So think about holding the butt of a little baby. That's the caudal end of the individual, okay? All right, so what's another one we can do? Oh, I know. Let's do medial and lateral. So one thing you need to think about with medial and lateral is what they kind of like what the terms sound like. And also don't forget, you need to be talking about this midline that separates the middle of the body or two halves of the body perfectly, the mid-sagittal line. Okay, we'll talk about that line again later when we're talking about anatomical planes, but just imagine that line is there when we're talking about medial and lateral. So as you can imagine, that line almost looks like it's in the middle of the body, right? So if it's in the middle of the body, it kind of sounds like medial, right? Well, something that is closer to the midline of the body is medial, while something that is further away, so towards the outsides of the body, this is toward the side or lateral, okay? Lateral. So when we're talking about different types of views, okay, like the lateral view of something or medial view of something, we're really just referring to this type of direction. So here, if we look at my image over here to the right, this is a lateral view of my body because I'm looking from the sides of the body. Medial would look a little bit creepy, and it does in certain contexts. Okay, so let's talk about another type of medial and lateral direction. One that pertains mainly to neurobiology, neuroscience in general, and having to deal with directions or certain things in the brain, okay? And that's ipsilateral, and contralateral. Both in their name are referring to sides of the body. Okay, sides of the body. To be ipsilateral means that you are on the same side of the body. Okay, ipsi sounds like same. Yeah, ipsi, same. Contra means you're contradicting yourself, right? So contradicting means you're on opposite sides of something. Okay, so contralateral mean that you are on the opposite side of the body. Now, the last pair that we want to talk about is a little bit more difficult looking from an exterior view of the body. It's mainly when we're talking about organs or points of interest that are deep within the body. So be deep within the body. Think about going into, oh my goodness. That was scary. Okay, so think about zooming in and digging deep into my abdominal cavity and going into and looking at my abdominal organs. That is actually what the term means when we're talking about, for instance, my abdominal organs within my abdominal cavity. They are all deep to my skin, essentially. So to be deep to something means you are moving closer and closer into the very depth of the body. Now, oppositely, that would mean that things that happen like scratches on your skin, like on your hand, I don't know, on your cheek, these are called superficial. Okay. Superficial means that you are toward the exterior of the body. So your skin is going to be superficial to something like your abdominal cavities or all of any of your internal organs, right? Okay, so those were our anatomical terms. There's one thing that we've started to segue into, and that's talking about anatomical planes. What are those? Well, anatomical planes themselves try to divide the body into different halves. And I say different halves because it depends on which way you are bisecting the body. So one thing that you need to remember is when we're talking about anatomical planes, you have to have this imaginary type of thing going on in your brain when you're like, okay, I'm going to slice the body through and through according to this specific line. Okay, just like you're slicing a cake. I know, terrible visual. I'm sorry, but that's the way you got to think about it. So let's think on, for instance, slicing the body directly down that mid-sagittal line. Remember that line that divided the body into left and right halves? Well, that's what this plane of view looks at. It looks at if we sliced the body right down the very center, down that mid-sagittal line, okay, and then you looked at both halves, you would see the organs that are superficial and deep within the body. And this is what allows us to see really cool things. This is what is called a sagittal plane. Sagittal plane, again, divides that body into left and right halves. And they're actually equal halves. There are ways that we can slice this in different directions where it's parasagittal. It's not perfect left and right halves, but it divides it into left and right halves. And you get really cool views, for instance, looking deep into bone structures that are going to be found in your CT scans or in your x-rays. Okay. And that's looking essentially at dividing the thing in half, okay, and then looking at a medial view from either side. Okay, so that one makes a little bit more sense, but this is when we start to get a little bit weird and the brain starts to go, what? When you're looking at these different planes. Think about now slicing the body from a lateral to medial direction. That means directly from the side, okay, just like the image is showing you here, directly from the side and all the way through. This is going to divide the body into two halves, yes, but it's going to be front and back halves, or anterior half and a posterior half. Yeah. So this is going to be called the frontal plane. Now, it does create some weird imagery when you're doing CT scan, but basically here we're looking at deep organs of the body, right? Especially in the abdominal cavity. Now, one that is most common, especially when we do things like histology or the study of tissues, is the last plane here that's going to directly bisect the body in a more, I guess, top and bottom half. Yeah. So a superior half versus a inferior half. This is what is called the transverse plane. This is also known as a cross section. Here is a really cool image of the brain. You can actually see that this is a transverse plane through the cranial cavity, almost at the nose. Okay, and you can see that here is the nose here protruding out of the face. So this would be the anterior part of the body or the head, and the posterior would be back here, just at the occipital lobe back here. Okay, and you can see that we're seeing deep into the brain tissue, looking like we took off the top half of the brain, which is a really way to think about this. Anatomy is just weird, okay? But again, these planes are super important when we are starting to delve into the deep organs of the body and characteristics of the body that are not necessarily visible through an superficial exterior view. And they're really, really common in CT scans and x-rays. So that's a lot of fun to do. Go try and look up CT scans and x-rays and figure out what plane they are in. Is it a frontal plane? Is it a transverse plane? Is it a sagittal plane? It's a fun exercise. All right, hopefully you learned a little bit of something about anatomy today, and study. You need to know all of these terms, planes, and anatomical position, okay? See you later.